look at some sex positions, are there some positions that can help a man to push this the Y chromosome faster, so they move faster? Yes.
Yes. So this is a very interesting question, and I think you've asked a very big question. I think I need to do some splitting.
Okay.
First of all, I think it's right for you to say fat men, because there's a difference between being stout and being fat. Yes. Because stout means you are tall and maybe you are muscular. Yes. But fat is fat under the skin. Under the skin, and belly and all that thing is different, and it's not healthy at all.
Okay.
Yes. So so the issue is you're asking is whether certain positions of sex, to be specific, permit the couple to get certain gender of the babies.
Yes.
Unfortunately, no. We don't have scientific evidence to that effect. But the other question you're asking is why are there more women
than men?
Why? Yes. Even you look at birth, more girls are born than boys, and in our population, men are almost half the number of the ladies. Why is it that? Why is that discrepancy? Nobody knows the exact reason, but there are some theories. There are some theories. Yes, there are some theories. Now, if you take at birth, there seems to be survival preference of one, the sperms, and two, the embryos after fertilizing. It looks like we are losing a lot of the embryos which were fertilized by the Y chromosome. Their survival seems not to be as good. For reasons we are yet to understand. They seem to be more delicate and survival is a bit low. So this translates into a discrepancy in the ratios at birth. Initially, we were thinking that these are more of nutritional. Initially, we were thinking that there's no difference. But there seems to be difference. Yes, there seems to be some difference. Even in the embryos we see in the lab, there seems to be differences. Yeah. So when we do IVF, there seems to be some bit of differences among the embryos as well. Yeah, so there has to be something which affects the survival, and it's maybe related to the gender at every stage. But even obviously, you see, women are more careful than men. Men take a lot of risks, so we do lose even more boys, more men, even in their later stages. There are some professions which, for a long time, they are confined to the men, and they are risky professions. Profession, armed forces, you'll find more men there. Even right now, there are ladies there, but you find if you go into the real frontline activities, you'll find more men in the front line operating risky machines and stuff like that. So men, by design, they take more risk, and they are more likely to be lost earlier. The borders, you see, most of them are men. And then this is, so there has to be something which affects our survival. Yes. So
even if you look at the old age number, in most cases it's women who live longer.
Yes, women live longer. That's true, because behavior, their bodies, actually biologically, women's bodies are more resilient.
I think it starts right from the chromosomes.
Very early.
Yes.
So
we move slowly, but we are strategic.
Yes.
We are firm and sure for the goals.
Yes.
And then the boys come in slowly, and they
end up earlier.
Is there any food that a man can eat to support the Y chromosome, to boost the Y chromosomes?
Okay.
Especially if they're getting on a girls, to give them energy to push faster and run the race quickly.
So unfortunately we don't have evidence to that, and that there is a particular food or medication you can take which can help you to get a particular gender. We still don't have any food that can help you with that. But there are ways in which, like what we said, part of IVF is possible. You can do the gender selection. But also there are some newer ways now which are coming up, which I think if they become available, they will be able to help. Now, in IVF, we select the gender. We do the test after fertilization. That means you have to go through the whole process of IVF. Yes. But there are newer methods, we call them cytometry. Now, this is where we do the sorting of the cells. Here we do cell sorting before fertilization. So this will help to reduce, because genetic tests are very expensive. Genetic tests are very expensive, and they make sex selection process expensive. So now these newer methods are using the ability to separate the X and Y chromosome sperms, and then you can either use insemination or some simpler method of treatment.
Okay.
Yeah.